I'm going to talk about a couple other common MSK conditions. First is compartment syndrome. This is a very important disease. It's a surgical emergency. And this is due to increased pressure in the muscle compartment. And that can be often after surgery. You get inflammation, you get fluid buildup, increased pressure. Increased pressure leads to compression and obstruction of tissue vessels. When you compress the vessels, there's less blood to the muscles. They get anoxia, you get tissue death. Not good at all. Clinical features is easy. There's 6 P's to remember in compartment syndrome. Pain, paresthesias, which is loss of sensation. Pulselessness, again remember, obstruction of your blood vessels, so you get pulseless. Pallor, again, also relates to the blood vessels. Paresis, which means you can't move the muscle, because there's also nerves in here that get compressed, as you can see here. And poikilothermia. It's a fancy word for the limb is too cool. You lose the temperature regulation. But again, it all boils back down to obstruction of the tissue vessels, compression of the vessels, compression of the nerves, leading to all these symptoms. This pain is worsened with limb flexion. You can imagine what increased the pressures and cause more pain. And this is a surgical emergency. You can lose that limb. You might have to amputate that limb if too much tissue dies because of that anoxia. So next is the Quervains Tenosynovitis, which is tendon inflammation of the abductor pollicis longus and the extensor pollicis brevis on the radial side of the wrist. So radial side of the wrist, I think, is a key word here. And it's due to repetitive thumb activities. So thumb is at the radial side of the wrist. You can see here as these are the tendons. You repetitively use your thumb, it's going to rub and rub and rub and cause inflammation and cause pain. And again, it's radial side of the wrist. You're going to have pain at the radial styloid. I've highlighted the radial styloid here. And there's a positive Finkelstein test, which is, again, you reproduce pain at the radial styloid when you stretch the thumb tendons. So imagine you stretch the thumb. It's the same idea. This is how you get the freaking disease. You stretch the thumb tendon, it's going to rub around. It's going to cause pain, cause inflammation and pain. So that's it for this part, compartment syndrome and the Quervains Tenosynovitis.